to get my PowerPoint going here, make sure everyone can see that, everyone can hear me, and then we will start rolling. So always the most anxiety-provoking part of the talk is making sure the technology is working. Can everyone see the slides and hear my voice okay? I'm getting some thumbs up. Wonderful. So as Brenda said, my name is Adam Mills. I'm a clinical psychologist at Nebraska Medicine. Today we'll just be talking about basically the role, the experience, and how to help with anxiety going through cancer, specifically when it comes to what is called Scanxiety, and we'll define that and talk about what that seems like it means and maybe even more what it really means and how this all plays out through this process. So I just wanted to start off and mention that I have no conflicts of interest. I have no financial relationships or financial conflicts of interest. So anything that I am discussing, recommending, defining is all evidence-based. It is all through the research and my clinical experience. I'm not sponsored by any pharmaceutical companies or anything that would bias me to push one thing or another. And as Brenda mentioned, I am on the board for A Time to Heal. So we do have a pre-existing working relationship where I have taught their brain fog class. I've done talks at their conferences, including coming up this year, and we work together on some different consultation projects where I can advise them on some of the programs they're doing and how I can what kind of the psychological side is for that. So I guess I'm a little biased toward A Time to Heal, and I'm very happy to be speaking on their behalf today. So let's start off with the big question. What is Scanxiety? Scanxiety is sort of a slang or colloquial term, really referencing broader anxiety through the cancer process. Specifically, I think it's not the scan itself that is always causing the anxiety through cancer, but it's what that scan represents. And typically, what that scan represents is a fear or worry about cancer coming back for those who may be in remission or have no evidence of disease. Or it may be fear for those who still maybe have active cancer. It's a fear of cancer progression. So while it is true that perhaps some aspects of actually getting a scan may cause some anxiety, when you're done with the scan, the anxiety doesn't go away. When you're done with the scan, in some cases, the anxiety can go up because now you're waiting for results. So really, when we talk about Scanxiety, we're talking about anxiety related to the possible results, the implications or consequences of the results from that scan, and of course, just anxiety related to the ongoing and sometimes permanent uncertainty about your future and your health. So there are some situations where maybe the procedure or the scan itself can cause some anxiety. I will briefly talk at the end of some assistance that can, some things that can be done for some of that. But really what we're talking about in broad terms today is what is mostly known as the fear of cancer recurrence. Now, when I say that, I want you all to kind of also be thinking that includes fear of cancer progression as well. So the fear of cancer recurrence or progression is something that most cancer survivors experience. I think the big, broad average estimation is 60%, but it can be as high as 90% in some specific populations. And, we're here talking on a Saturday morning about how to get help with anxiety. The implication there is that anxiety is bad. And we'll talk about how it's more complex than that. And in fact, there are elements of anxiety, elements of health-related anxiety, elements of the fear of cancer recurrence that are actually quite helpful, that they're adaptive. And so we'll talk about how is anxiety helpful, how does it get unhelpful, and what do we do especially when it's unhelpful. So research shows that it's really a double-edged sword in that it can be helpful and unhelpful. How can anxiety be helpful? A lot of folks who have experienced health problems, or a lot of folks, especially cancer, a lot of folks who have experienced cancer report that maybe they did not necessarily highly prioritize their health prior to their cancer experience. And as a result of what they're going through, they are just more on top of their health. Their health is more important to them. They may be more committed to just becoming healthier. They feel like they know more and they have a better sense of control about how to stay healthy. And so these are some of the ways that anxiety can actually be helpful. If we had no anxiety whatsoever, we would not have gone to the doctor in the first place. We wouldn't buckle the seatbelt. We wouldn't look both ways before crossing the street. So there's a little bit of anxiety that can be helpful. But on the flip side, when anxiety becomes unhelpful, we can start to see some of these types of behaviors. First of all, I think a lot of us through different health challenges have gotten a second, third, fourth, or fifth opinion from Dr. Google or WebMD. Sometimes trying to dig up information can end up causing more problems than it solves. It just seems like almost whatever you plug into WMD or to WebMD can end up being, well, I got a runny nose. Well, it could be cancer, right? Or, I stubbed my toe and my toe hurts. It could be cancer. And sometimes we end up going down the rabbit hole a little too quickly with some of that. So when fear of cancer recurrence results in sort of excessive researching, looking for new studies, trying to decide, okay, we learned this about rats on this new chemo drug, but how would this apply to me? Sometimes that ends up just causing more stress than it ends up solving. Sometimes we maybe instead of turning to Dr. Google, we start asking our friends, our family, hey, I've been having this pain or been a little dizzy lately. Do you think that's okay? Should I call my doctor? And a lot of times family members and friends find themselves in the position of trying to reassure their loved one. And that might actually become a little bit of I don't know, a challenge in a relationship where one family member might feel like they need to calm the other one down by just sort of downplaying symptoms, and then the cancer survivor feels like they're being invalidated or that no one's listening or they're not being heard. And so it puts a lot of pressure sometimes on relationships when we're taking some of our medical concerns to our family. Now, the alternative is you call your doctor's office or you send them a message in the chart with the concern or the question you have. But I think cancer survivors have mixed feelings about that as well. I've heard a lot from my patients. I don't want to bother them. I don't want them to think I'm a hypochondriac. And there's, what I tell my patients through this is that there's a full range of possibilities when you're sending messages. First of all, if you have a legitimate question, if you have a legitimate concern, and the main thing holding you back is that you don't want to bother your doctor, you're kind of overemphasizing the outcome of that. You're almost like trying to read someone else's mind and assuming that if you message your doctor about a health concern, it's going to bother them. I would encourage people, if you do have legitimate concerns, to make that phone call, to send that message. You don't know that if you sit on it and you wait and it ends up becoming a bigger problem, maybe you're going to bother your doctor that you didn't message them in that case. And so we can't predict how someone else is going to react to messages. I often, joking with my patients here, say, if your doctor thinks that you are sending too many messages, they'll probably be calling me and asking me to make sure I'm meeting with you enough. Or they might say like, hey, are you going to see Dr. Mills soon? If that's their response to your question, then that might be a situation where Perhaps there are too many questions going in, but I think if your health is important to you, and one way you have to control your health and take control of this situation is by getting information from your doctor rather than getting your information from Google, I would recommend that you reach out when you can. So back to how Scanxiety can be unhelpful. Sometimes it can lead people to end up presenting more to like the emergency room, or going to urgent care. It can they might be finding themselves going to the doctor much more frequently because they just can't shake the idea that no matter what is going on, it could be cancer. Um, this is common. I actually overheard in the cancer center some oncology nurses talking to each other about how even they feel fear about cancer, mostly because of what they're exposed to through the day. They were joking that, basically every note that they read starts off with a patient who presented to their primary care for a dry cough that ultimately was diagnosed as lung cancer. However, their colleagues in family medicine, every note that they read where a patient presents with a dry cough ends up being seasonal allergies. And so those who are around cancer a lot think cancer more. And so it's common, especially having, when you've gone through cancer, that no matter what the symptom is, your first thought is cancer. That's very normal. The question is, what do you do after that? Are we in that helpful anxiety state, or is this more of the unhelpful anxiety? And sometimes the fear of cancer recurrence or progression can be intense enough where it can lead to some pretty extreme avoidance. And unfortunately, I have seen this with people who are so scared or convinced that they have recurrent cancer that they might not go to their scans. They might not go to their visits. I've had patients who were highly recommended to get like a brain MRI because they were having symptoms that were concerning. And they told me, I don't want to go because I don't want to get bad news. Now, the avoidance in this case is not preventing the bad news, and it could actually be making the situation worse. But as we'll talk about throughout this talk, sometimes that anxiety gets so intense, it ends up having the opposite reaction of what it's supposed to be doing for us, which again, in small doses, anxiety is supposed to be helping us. So that's how Scanxiety can get almost to the point where it's debilitating for people. Those who end up experiencing very high and unhelpful levels of anxiety end up reporting lower quality of life. They end up feeling more limited by physical issues, including pain or fatigue or other physical issues. They feel more stressed, more depressed, have higher anxiety, and it puts a strain on some of their relationships as well. When the fear of cancer becomes, almost more of like an obsession, it can be very impairing for people. So hopefully this is convincing that we don't want anyone to be at this point. And if people are feeling like they're trending towards this point, or they're feeling like some of this anxiety is more on the unhelpful side, hopefully some of the information we cover today can be helpful to get you back on the right track. Want to just give a bit of information about what we're dealing with when we're talking about anxiety. Like why can anxiety be helpful, and why is it in some cases not helpful? What is the purpose of anxiety? What is the goal of anxiety? So evolutionarily, the goal of anxiety is to keep us alive. It's to save our butts in a dangerous situation. So I have some examples here from these photos of an animal attack or a natural disaster or a situation where in the next few minutes, your life is in danger and you need to take action. And that's the core of our fight or flight system. And hopefully that's a familiar term to people. Our fight or flight system is the anxiety system in our body that basically takes over all of our body's functions in order to get us through the next few minutes and save our lives. So a common example of our fight or flight system kicking in is if you step out your front door and there's a bear in your yard, your fight or flight system would kick in, and most likely, hopefully, most of you would flee, would run, would get back in the house, shut the door, lock the door. Um, those of you emboldened enough to fight, right? What's happening in your body could actually help that. Your heart rate is going to increase, your blood pressure goes up, your muscles tense up so you can punch harder or run faster or jump higher. Um, your senses kind of zero in. You get like laser vision, and your sense of hearing is better. Your sense of touch is better. Those are all really fantastic automatic changes that happen when we're in a situation like that, when we need to get out in the next 30 seconds in order to survive. This anxiety is helpful in the situation where you can take action because of the danger, where you need to do something to be safe. And over the course of generations and generations and generations of human beings, those who had anxiety and ran away from the bear survived and had babies, and those who tried to go up cuddle the bear did not survive and did not pass those genes on. So we have found ourselves as humans very good at having a fight or flight response. However, and I don't know about all of you, I tend to not have a lot of bear encounters in my everyday life, yet our bodies typically react in the same way no matter what the stressor is. So the problem with our anxiety system is it's always trying to fight a bear, no matter what's causing us stress. But nowadays, many of the physical changes and symptoms that happen because of anxiety no longer fit the problem. So many of you waiting for a scan, waiting for a call, getting a notification on your phone that your test results are in, getting a call or a letter from your insurance company, all these things that are stressful for us today. What happens when you're in those situations? Your heart rate increases, your blood pressure goes up, your muscles tense, you get tunnel vision. The same thing that you need to fight a bear, but now we're talking about a phone call. And in this case, with a phone call that has important results on the other side of it, being able to run faster, to jump higher, to punch harder, that no longer helps. So our body is treating every stressful situation as a run away from a bear situation. And that's a problem. The physical changes that we experience do not match what we need to get through these stressors. Our anxiety system sort of assumes every time that we can fix or solve the problem if we're just anxious enough. If it motivates you enough, you will fix the problem today rather than wait. So that's why sometimes we have these unexplained anxiety spikes. It's really your brain trying to get you to solve the problems that are out there. Unfortunately, most of the problems that we're talking about are long-term, chronic, and uncontrollable. And that is not a situation where we need some of these physical changes. So right back at this theme of some anxiety is helpful, a lot of anxiety isn't. When anxiety starts to backfire, that's really when we want to be aware and when we, want to consider taking some of these strategies that I'm going to talk about later, because we are anxious about things that we care about. However, if we're too anxious about these things, it starts to actually pull us away from the stuff we care about. So we can be so anxious about our health that we start to act in unhealthy ways, or we don't even feel healthy because our anxiety is so high. Maybe not sleeping well, maybe not eating well, maybe not engaged in your usual activities. Trying to get more information through excessive researching in order to calm that anxiety down, right? The anxiety is up because of the unknown, and trying to solve the unknown for a lot of people ends up causing more anxiety and more uncertainty. Dr. Google doesn't always have the right answer for you. And by looking to try to solve some anxiety, you end up with even more. And lastly, the fear of not being around, the fear of losing your life can be so intense that people actually kind of stop living. It all just becomes focused around the anxiety. It becomes too focused around their health, and they're missing out on other important areas.
Dr. Mills, we have a
Yes,
question from
yes.
Priscilla, and she wants to know, is procrastinating related to anxiety?
There's like a little, yeah, there's like a little kind of a recipe, right? Anxiety and perfectionism can lead to procrastination. It's a great question because if we think of anxiety on a spectrum, we need that healthy amount of anxiety to pressure us into action. And unfortunately, that healthy amount of anxiety is like slim, right? If we have not enough anxiety, then we're not really pushed into doing anything. Oh, I'll get to it later. And if we wait until the absolute last minute, we're starting to now get into the maybe a like helpful anxiety plus, where it's actually now a bit more frantic, a bit more stressed. So this is kind of what procrastination does is we wait until there's enough anxiety to get started, but maybe you waited too long and it's actually becoming unhelpful because it may be more difficult to concentrate. You may end up, not sleeping well because you're having to stay up later to get something done. And so, yes, it is related to anxiety. It's basically a mismatch between that, we're kind of missing that optimal area of anxiety, and it ends up causing almost more stress, right? And so then your brain learns like, okay, well, we got the project done, or we got it done, but that was really uncomfortable. So the next time you have something you need to do, your brain remembers the discomfort and then it doesn't want to do it, and you end up procrastinating again. So I think it's a good question, and I think it fits into this idea of this spectrum of anxiety having different areas of helpfulness and unhelpfulness. All right. So I hope I'm convincing everyone here that we don't want, well, we can't make anxiety go away, first of all. There's no way to make it go away. I've had so many people ask me over the years, well, why can't I just stop worrying? Or I just don't want to feel anxiety anymore. And I tell them, the bad news is that's impossible. But that's also good news that that's impossible, because if you had no anxiety, then you're not looking both ways before crossing the street. You're just walking right out there, free, free as ever. So we don't want anxiety to go away. How can we keep it in this optimal, helpful range? Like, how can we keep it in the right place for us to, stay focused on the areas that matter to us, but also stay motivated to be healthy? So our goal here is to find the balance between staying healthy, which because of cancer has been threatened. And for a lot of people, it just changes how they think and feel about their health and their life and their relationships and their goals. So with your health being challenged like this, it really shows us, it becomes our greatest fear of not being healthy. So how do we find the balance between staying healthy but also staying engaged, staying on your path of what matters to you? Because without the anxiety, then you're probably not staying healthy. But with too much anxiety, you're probably not staying engaged. How do we shoot for this perfect balance? We're going to talk about how to anticipate anxiety. So there are times when it comes to fear of cancer, recurrence, or progression, or scanxiety, where we know we are going to be facing increased anxiety. We have the luxury of knowing when is it going to increase. I could talk to each of you individually, look at your schedule of upcoming appointments over the next year, and we could probably graph when we expect anxiety to go up for you and when we expect anxiety to be better. So we need to know how to anticipate it. We need to know how to manage anxiety, whether it's anticipated anxiety or whether it's catching you off guard. I want you to have the tools in order to do that. We always want to keep anxiety in perspective because, again, the goal to eliminate or reduce anxiety is going to be frustrating because that's not going to happen. However, I'm going to talk about ways to what we call distance from the anxiety. So you're almost, in a way, recognizing that anxiety is happening in your body. And instead of being like underwater with it, you're instead seeing it from a distance. You're understanding why it's happening, and you're going to have a plan on how to deal with it. It's actually, if you're accepting that anxiety is part of being human, anxiety is part of caring. Anxiety is necessary in order to stay healthy. If you accept that anxiety is part of this whole package deal that we're living right now, sometimes then it helps us live with anxiety instead of stopping our tracks trying to make it go away. So we'll talk about the different perspectives on anxiety. And then lastly, staying engaged despite it. Not once it's gone, not once you're anxiety free, but despite anxiety, how do we stay engaged in our lives? How do we stay connected to the things and the people that we love? Because that's what we're afraid of losing. So when do we expect anxiety to happen? Well, when you have an appointment coming up, when you have scans coming up, when you've had your scan and you're waiting for results. And just a note about that, it is a brand new dynamic in the last 5 to 10 years that, because of laws for transparency with your own medical record, where you should have access to everything in your medical record, it is very common for patients to get test results hours before their doctors are even looking at it, days before their doctor is going to call them about it in some cases. And that has added a twist. As a psychologist trying to help people, it has added a twist to this whole thing, knowing that a patient may end up with test results on their phone before they're even in the parking lot of the med center on their way home, and they won't see their doctor for another couple of days. How do we manage that unique situation as well? You can, some people experience anxiety around anniversaries of their diagnosis, of starting or finishing chemo, of having maybe transitioning into like early survivorship if they went into remission. So sometimes anniversaries can pop up. I think some people are fairly aware of this, and they're aware of how it impacts them. And I have also had patients who, for whatever reason, realized they were having kind of a crummy week, and they couldn't put their finger on it until it dawned on them that this happened to be the anniversary of their diagnosis. And they weren't really thinking about that, but it was still impacting them, even, kind of beyond their awareness. You can possibly expect anxiety if or when you're getting together with people that maybe you haven't seen since your diagnosis. um, Happy events, holidays, birthdays. Some people experience the joy of those events, but also there's like a bittersweetness to it where they may be thinking like, how many more of these Christmases do I have left? And so some people may even consider avoiding these types of positive events because they're a little afraid of how bad they could feel, and not really focusing on how important or good they could feel.
Dr. Mills, I have a personal experience to share
Please.
that
Yeah.
maybe others have shared or have happened. Certain smells even can trigger it. I was getting my COVID shot,
Yeah.
and they did, they had to swab me, and that alcohol wipe, I started having a panic attack. And I didn't recognize it for what it was at first, and then I realized it was the smell. It was taking me back because I had a port, and they would
Yes.
always do that
The
before an
plus.
infusion.
Mhm.
And it just triggered my memory so strongly that I had to say, hold on a minute. Just give me a second. And I actually verbalized it to her, and the nurse was so nice, and
Oh,
she
cool.
totally understood. So I think also, does it help sometimes to go ahead and tell people, hey, something's happening. I feel anxious. Can you just give me a minute? Um, I don't know. Even sometimes I know for a friend, it was walking into a hospital to
Yes.
visit a sick friend, and it set them off.
Absolutely. Yep. If you're comfortable sharing that you might be a little more on edge about something, you absolutely can. If you feel like instead, like maybe you want to, you don't know how you're going to react, but you don't necessarily want to like go into it with somebody as well. You can use some of some of the techniques we'll talk about on how to bring some of that anxiety down as well. So I think there's a lot of different approaches. Um, just kind of while we're, I just wanted to touch on like the social gathering piece as well, because a lot of times if you're seeing people for the first time after your diagnosis or after your treatment, they're going to be asking a lot. You're going to get the little pity head tilt, like, how are you? Oh, you poor thing. And people don't want to feel that way. And it's just going to be sort of reliving things over and over and answering a bunch of questions about your health. And for a lot of people, that seems uncomfortable and awkward, and they just don't want that to be how they're defined. And so people are always asking me, well, like, well, how do I handle this, or should I even go? And if we look at the alternative of like, well, if you don't want to go through the discomfort of talking about your health or cancer with people, one of the more extreme alternatives is like never leave your house again. And I would not typically recommend that for people. What I would recommend is framing their concern is in some cases an act of love, an act of care, and recognizing that for the first time you're re-engaging with people, they may have tons of questions and it may be about you and your health, but it won't always be that way in a lot of cases. Like a lot of times, the first time you kind of go through the health stuff with them, and then after that, things may start to feel more normal. That said, I know we could do a whole other talk on the complication of relationships going through the cancer process. So this is not always the case, but I recall one patient I was working with years and years ago who every year loved attending the neighborhood block party for like 4th of July or something. It was a big deal in her neighborhood. Dozens of people would get together. And this year was the first party after her cancer diagnosis, and specifically the first party she would be attending after losing her hair. And she said she wasn't going to go. She did not want to have people see her without her hair. And it broke her heart because this is a really important thing for her to attend. So, going into psychologist mode, a conversation I oftentimes have with people like this is, well, what's the worst thing that can happen, right? Like you're going to have a lot of people who care about you. And they're going to be thinking positive things about you. They're going to be expressing their concern and love for you. Yes, they might notice you don't have hair, but that's not going to be this. That you're not your bald head. You are a human. You are loved. You are cared about. And so some people might ask you questions, and that's probably about the worst we can expect. And you know what? I did my job. She went to that block party. She came back for the next visit, and I was ready for her to be like, nobody even mentioned it, and it wasn't a big deal at all. And she said, I had a couple people ask if they could rub my bald head. And I was not expecting that in terms of a worst case scenario. They must be very neighborly in that neighborhood. So it caught me off guard, but ultimately she had an amazing time. She was doing the thing that was her, that was important to her. And even though a worst case scenario of awkwardness happened beyond what I would have even guessed, she loved it, and she was planning on staying engaged with people. So there will be an initial bump, right, of stress and anxiety when you're re-engaging with people that matter to you, or when you're doing things that you love doing. However, uh, a lot of times it ends up being worth it, right? It's part of the package deal, but it ends up being worth it. Okay.
Dr. Mills, on the
Yeah,
other side of the coin, we've got a couple comments in the chat
sure.
about or questions like, for example, from Priscilla, my experience was feeling like I got a lot of attention when I was actively being treated. Now that I'm in a routine of remission infusions, I get less attention. Someone agreed with her. I'm not
Yes.
even in remission. The attention has all gone away. I don't want a ton of attention, but a consideration for my ongoing treatment would be helpful. Another thing is too, sometimes is right after even treatment is over, you may look fine. I think everyone can relate to this. You
Yep.
may look fine on the
Invisible. Yep.
outside and you're not fine on the inside. So what would you say to those folks? And then I'll have another question for you.
Sure, sure. Okay. So it's really common at certain milestones, a diagnosis, especially like a Facebook announcement of a diagnosis, or I'm starting treatment, or my surgery's coming up. You get sort of these bursts of well wishes and offerings to help, and then those kind of, this is the chronic nature of cancer, right? Where after something like that, you get this almost more attention and help than you need at the moment, more casseroles you could ever consume. You don't have the freezer space. But when you really need the help is in the long run, in the middle of treatment, when you're out of the hospital from the surgery, but still can't lift anything over 10 pounds, and so oftentimes the timing of social help ends up being at the wrong time, and it's a real challenge for people. And again, this would be probably a totally different talk and a lot more in depth, but oftentimes we just have to rely on some of our core groups of people to maybe be the ones to kind of manage some of these conversations. This is why people will do things like a Caring Bridge or other websites and have somebody else manage it, so they can be the ones to organize what help they need or what help the patient might need, and call out for that in some of those off times when you don't really, when other people don't think you need the help but you do. So it's a very complex topic when we talk about the social side.
I would agree with that. And just to add one more thing is I love the idea of having someone else manage that, Dr. Mills. That's a
Yes.
great idea. And a lot of times folks also don't know what to do. And they want to help, but they don't know what you need or what they should
Yes.
do. So that's a great advice. So the other question was, and this is a tough one, and maybe you're coming to that overall, how do you accept anxiety
Yeah.
in your life?
We will certainly be getting to that. Yes, because accepting doesn't mean liking it. Acceptance is the idea of not focusing too much of your effort actively fighting it, and instead realizing that it's kind of a monkey on your back. It's part of the human condition. Same thing with fatigue, chronic pain, side effects. Like there's a lot of stuff that we accept without really realizing we're accepting them. And when we talk about acceptance, I think people immediately feel like that means being okay with it. And what I'm talking about acceptance, which I'll get to in a bit, it's a little more, it's a little different than that. It's more of a philosophical form of acceptance. Okay, I'm gonna keep rolling here. So this is when we know anxiety is gonna hit, right? Well, what about, how does anxiety hit when we're not expecting it? Man, this is interesting. These are interesting conversations. You just put on, you're trying to keep yourself distracted. You're trying to keep yourself focused on positive things, and you put on a movie where a little boy finds a little dog and they become best friends, and then boom, the dog is diagnosed with cancer or something. You start a new TV show, and boom, it's about cancer. You're driving to go do something you're excited to do, and an ad for Nebraska medicine comes on, or you see a billboard with your doctor on it or something. So a lot of times we're trying to go through our lives, and all of a sudden we just get hit with this unexpected reminder of cancer, including some of these things I talked about with the expected ones, like social gatherings and stuff that we think are just going to be positive, and then it ends up being you hear about someone else diagnosed, or people are just asking too much about your health, and you weren't maybe anticipating that. But also probably the most common unexpected triggers of of cancer related anxiety would be a new symptom, a new pain, some sort of physical change. And for a lot of people, that they just sort of immediately think that it might be a sign of cancer or recurrence or something pretty terrible. Their mind sort of doesn't go with the first, maybe like the higher probability guess of like maybe it's nothing or maybe it's a cold. You immediately start to think, well, there's something in my lungs, right? And so that can catch a lot of people off guard. And what do we do? So I work a lot with people to anticipate every visit I have. While we're wrapping up, one of my final questions is there anything coming up in the next couple weeks or the next month or so that you feel could be stressful? And for a lot of people, they say, well, I got my scan, I got my follow-up coming up. And so we come up with a plan. I'm going to get more in depth and talk about specific forms of relaxation in a little bit. But we come up with a plan to keep, basically prior to a scan, there's almost no way to eliminate that anxiety. So a lot of our focus is going to be on keeping yourself relaxed by engaging multiple times a day in relaxation exercises, which I will go into in a bit, keeping yourself distracted, even sign up for a free trial of a new streaming service, or get a new puzzle, or make some plans or something out of the ordinary to reduce the amount of time you're sitting around thinking about an upcoming scan. Because thinking about an upcoming scan, what it could end up saying, what it all means in the end, how bad could it get, none of that is helping you control the situation. However, your mind thinks if it bullies you enough with anxiety, you're going to fix it all today. So knowing that that's not true, we really want to emphasize, what we can control, what we can't control, remind yourself, and this is kind of that acceptance of anxiety, that just because you're having anxiety, it's just a reminder that your mind cares about your health. You don't need to take action on it. You don't need to go down the rabbit hole. It's just your body remembering that your health is important. When you're going to see people, and that can cause a little bit of that anxiety, you can have like, this is almost like a little mini course in PR, like public relations 101. Have like a canned response, right? Where, people are going to ask you about things and you can just say, I'm doing okay now and we'll see how the future holds, but I'm staying positive, right? Just repeat the same thing. You don't have to go into details. You can really just sort of say, we're hanging in there okay, and I'm trying to focus on other good things in my life. And thanks for checking in on me. So actually, kind of practicing that or having that ready to go can help you anticipate some of the things they may say or ask, and reminding yourself, it's kind of like, okay, bless their hearts, right? Like, how nosy are people getting these days when they'll just start asking you, like, how are you recovering from your surgery, and just really kind of in-depth things. They're bringing it up because they care for the most part, and they just maybe aren't super tactful about it. And frankly, again, separate talk probably, but people don't know what to say. They don't know what to ask. They feel awkward. And so they just, in some cases, aren't very good at communicating with somebody they know who's going through cancer. And so just remind yourself, like, it's not their fault. They're just they just don't know what they're talking about. So you can plan for some of these things. What about those unexpected triggers? I want you, just kind of have a plan. Have a plan for, like, if there's a time where you get unexpectedly anxious because of something that you weren't anticipating, just have a plan. Things, you can write some stuff down, you can do some relaxation, you can have, a game on your phone or something that's always a good distraction. You can call somebody. And then again, reminding yourself that this anxiety is happening because you're alive and you care about your health. And so it helps create distance from that anxiety. So I call this like our break glass in case of anxiety, right? Where you just always have something you can go to in case you end up feeling unexpectedly anxious. Again, a lot of that stuff you can do anytime, anywhere, especially some of the relaxation exercises. And I will recommend with relaxation and um, and even like your activity level, that it's a lot easier to prevent anxiety than it is to react to anxiety. If you are somebody living a life of valued activities and you have things you're looking forward to and you are regularly engaging in relaxation and managing your stress and worries well, you're unlikely to experience maybe the intensity of anxiety. Even if you get caught off guard, you have so many other things you're focusing on. And through relaxation, your average anxiety level is probably low enough that it doesn't just jump up to 10 out of 10. It might bump up to 5 out of 10. But really, we want to talk about, fireproofing rather than just putting out fires all the time. Now, if you are anxious, I'm still going to recommend relaxation and distraction to get through those moments. It just might not feel as powerful because you're now competing with this part of your brain that has been helping humans flee from danger for, thousands and thousands and thousands of years. And so we're competing with an instinct basically at that point. So I think both having a plan to react to anxiety, but especially prevent anxiety can be super important. What about the new symptom? What about the new pain? So, first of all, through the survivorship process, you should, especially if you are going through this difficult part where you've been seeing your doctor like once every 2 weeks, once a week for the last year or two, and now all of a sudden they say, see you in 3 months, like Brenda called it, falling off the cliff, right? There should be, through survivorship programs, there should be education, facts, information about what to watch out for in terms of, either cancer recurrence or new problems that might emerge because of your health history or your treatment history. And so you should have a list of symptoms where your doctor says, call us if you start to experience this. And if you start to experience that, you should talk to your doctor. And that's one of those areas where, again, if you don't want to bother them, well, you might be bothering them by not contacting them when they wanted you to. So you don't have to protect their feelings. You just need to, sort of follow the directions there. Um, if you have a symptom that doesn't fall onto this list, contact your doctor. Get that information. They'll most likely reassure you. They might say, well, you should probably talk to your primary care, which is like, wait a minute, I've had to run everything by you for, the last 2 years, and now you're telling me to talk to my primary care doesn't even remember me at this point. But they will guide you in the right way. And so, especially if you are in early survivorship, it is important to just get the information and facts that you need, and then remind yourself when you have that information and you have those facts and you've gotten that reassurance that, hey, this just sounds like allergies, I don't think your cancer's back, then refocus on continuing forward in life. Refocus on your values and getting re-engaged in them. All right, I did a whole talk at the conference, the A Time to Heal conference last year on different forms of relaxation. I have taken an hour's worth and boiled it down here into one slide. So bear with me on this, but there are multiple forms of relaxation. There are pros and cons of each of these, and I'm going to go through that because this is really step one in managing anxiety. And I want to go back to the bear situation. And why does this guy talk about bears so much? Well, I want you to remember physically what's happening in your body when your brain decides you are in danger. Your heart rate increases, blood pressure goes up, muscles tense. It basically makes these decisions for you. Your physiology changes in that moment. Your brain does not wait for your input. It just makes all these changes. And in a bear situation, if you run back inside the house and you see the bear run back off into the woods, your brain at some point will decide the danger is over. okay, we're safe, call off the dogs, your heart rate slows down, your breathing slows down, your muscles relax, your adrenaline, kind of starts cutting out. So in the case when your brain decides you're okay, your body will go back to a relaxed state. When you're dealing with cancer or any health problem or any kind of chronic stress or anxiety, work problems, relationship problems, financial issues, whatever. When we're dealing with chronic stress and anxiety, think of yourselves going through the cancer process. When has your brain decided, now it's over, now we're good, no more problems? For a lot of people, the answer to that is never. It's always out there. I've heard it's always in the back of my mind and a lot of times in the front. So, in situations where your brain is not going to decide for you that you are safe and okay in this moment, we need to have ways to tell our brain that we are okay. So, our brain, which controls our body functions, to tell us we're safe or in danger, we need to have control over some of those changes. We need to have control over that in order to tell our brain we're okay. It's kind of like we're reversing the process. Instead of waiting for our brain to say we're safe, through relaxation, we're telling our brain, in this moment, I think things are okay. So how do we do that? Because we don't have control over all of our body functions. We don't have control over all the changes that happen in our body when we're anxious. We do have control over a few. One of those, the most important, is your breathing. When we are anxious, we breathe fast so we can pump the blood through our body faster, so we can run faster, jump higher, etc. If we purposefully slow down our breathing, we are telling our brains we are okay in this moment. We will teach our brain that when we take control of our breathing, that means things are okay. Now, breathing is one of those things that we do automatically, that we can take control over, but we're not always paying attention to it. And that's good, because if we had to think about every breath we took every day, I don't think I could load or unload a dishwasher without passing out, because I'd get distracted and I'd forget to breathe and down I go. So thankfully, we don't always need to think about it. However, if it's on cruise control most of the time, and most of the time we're stressed out, guess what? We're probably going to be breathing in a way that keeps us stressed out. So, taking control of our breathing by slowing it down. And I just want everyone to practice this, because it feels good when you do this. And you're going to notice, even with my, frantic animated talking, usually I'm like pacing around the room when I do talks and stuff. Thankfully, y'all got me sitting still today. But you're going to notice when I'm talking you through this that even my voice is going to slow down, like everything kind of slows down. But deep breathing, what we really want to do is take a deep, long breath, and you want to feel it in your stomach area. So when you're breathing and the air is getting down to like your diaphragm, which helps your lungs fully inflate and deflate. When you do that kind of breathing, that's really telling your brain like, hey, things are okay at this moment. So everyone, if you can, just take a slow breath in, just like breathe in for like 4 or 5 seconds, and just hold it for another few seconds. And now slowly breathe it out for maybe 5, 6, 7 seconds. So we're going to breathe in, hold, and breathe out. Nice and slow. You will see online on apps what's called 4-7-8 breathing. The idea, you breathe in for 4 seconds, you hold it for 7, you breathe out for 8. There's no magic number for this. They put 4-7-8 to kind of help you count it out, but you don't have to follow that. If I hold my breath for 7 seconds, I just about lose it. So you adjust this to what's comfortable for you. I like to encourage breathe in through the nose and out through the mouth. But some people, if you got a stuffy nose, maybe that's hard to do. So in that case, breathe in through the mouth and breathe out through the mouth. A lot of times it feels good when that breath out takes a little bit longer than the breath in. And I hope by doing this, even with me blabbing on top of it all, I'm hopeful that you're just noticing, just from a couple breaths, a little bit of a little bit of a different feeling, a little bit of relaxation. What you're doing is you're putting your body in the state that it is when your brain decides we're okay. And if you do this, again, it sends the signal to the brain that we don't need the anxiety right now. Thanks, but no thanks. I appreciate the reminder, but we're okay. So deep breathing is nice because you can do it anytime, anywhere. Nobody knows you're doing it. It's not like you're huffing and puffing. You can be very subtle about it. I recommend for people do it at stoplights while you're in the car. Do it on the elevator as you're going up to the clinic. Do it in the waiting room. Do this, do this in between when if you're getting home from work and you're going into a house with busy, noisy kids or something. Give yourself a few breaths before you go in. Give yourself 1 minute in between a meeting at work. Just do this breathing. You can listen to exercises on apps or on YouTube that walk you through this, but you don't always have to have an app for deep breathing. Now, muscle relaxation, and in fact, what's called progressive muscle relaxation, because you go through different muscle groups in your body. This is like, this is deeper relaxation than deep breathing. You actually do deep breathing while you do muscle relaxation, but it takes a bit longer. It can take 7 minutes, I think is about the shortest I found, 20 minutes, 30, 40 minutes to go through a muscle relaxation exercise. And not everyone has that block of time, right? But by doing this, what you do is you tense up certain muscle groups and then you let them go. And when you let them go, it brings in a sense of relaxation, and it helps you learn how can you relax the muscles that tend to get tense, our back, our shoulders, our neck. We feel tension here. And if I just said, hey, why don't you relax your neck for a minute? You'd be like, what? How do I do that? But the exercises talk you through the different stretches and poses you can make to relax those areas of your body. If you practice muscle relaxation frequently, you will notice where you're tensing up a lot sooner than we do now. A lot of us white knuckle through our day and don't even realize it. So muscle relaxation is deep relaxation, but it takes a bit longer. You maybe have to listen to something to walk you through it. Mindfulness is kind of a buzzword. Really, it's kind of a way of life, and it's a thing you can practice. Also, it's not just a technique and it's not just a philosophy. Mindfulness is really focusing on one thing at a time rather than just like multitasking. So like if you're eating, you're just like focusing. How does the food taste? How does the food feel in my mouth? Is it warm? Is it cold? Like what flavors do I notice? Like really intensely focusing on just one thing at a time. People who practice mindfulness, maybe you're out on a walk and you're feeling, what does the air feel like? What, is it warm? Is it cool? Are there any smells in the air? Like, what do you hear around you? You're really engaged with your senses when you do mindfulness. What it does is it helps you really appreciate the simple things that we sometimes just go through the motions. We use that cruise control almost too much, and then we don't enjoy the meals that we pay for, at a restaurant, or we don't listen to the music that we're playing. We've heard it 1,000 times, but we never listened to the lyrics of it. And so mindfulness exercises help you like pay attention in a very specific way to enjoyable things. A few others, you can find meditations, you can find guided imagery, usually on apps or on YouTube. There's some apps, there's one called Insight Timer, which has always been free. And so that's one. There's a lot of other apps like Headspace, Sanvello, that used to be free and now they charge and they have subscriptions and stuff that I don't always love guiding people towards. Sometimes maybe if you're working or your insurance company might pay for subscriptions to some of these apps though, so you could always look into that, or maybe through like your work benefits. But meditation is, people think it's like turning off your brain. It's not really. It's more kind of distancing from your thoughts and just letting your thoughts kind of float by, and just trying to focus on your breathing, and trying to not think about anything too specifically, but instead focusing just on how you're feeling. And that can be really calming. Guided imagery is sort of like going to your happy place. It might be an exercise online where it's like imagining that you're walking on a beach. How does the sand feel beneath your feet? What is, are you feeling like the spritz of water? So it's kind of like being mindful, but in a like imagination kind of a way. So these are all fantastic forms of relaxation. They're all evidence-based. I stick with the deep breathing. I've done the deep breathing long enough that when I take that first breath, my brain already knows we're going to end up relaxed. And so it starts to help me feel relaxed because I practiced it. All of these require practice, and it works best when you've practiced these during your normal okay times rather than only waiting until you're really stressed out, because it's going to be harder to focus on them. And so it's like, we got a Super Bowl tomorrow. I don't know if I can call it the Super Bowl or we're supposed to say big game or whatever, but each of these teams practices every play multiple times so they can do it in their sleep. It's muscle memory. You need to do this with relaxation as well. You need to practice, you need to rep it, because it becomes more muscle memory. That way, when you need it, it works even better. So that's my discussion there about relaxation. Okay, worrying. I could again probably talk all day about worrying. We worry about things we care about, and I want to separate those things. Caring about something, you can care about things without worrying. When I talk about worry, I'm talking about when your mind starts to say, well, what if this could happen? And then, then that could happen, and then that could happen. So, well, what if my scans have bad news? And then what if I can't tolerate the treatment that they want to put me on? And then, what if I'm not even around next Christmas, right? Your brain sort of goes to the worst case scenario and then jumps to the next thing and the next thing. Worrying is a way that our brain tries to get us to solve the unsolvable. So we recognize that it usually doesn't help. Sometimes people feel that worrying helps them prepare for bad news, but for those who worry a lot, that means you're going to be stressed now when you're thinking about it, and you're going to be stressed just as much when it happens. And you maybe things that don't even ever happen. And so then you were stressed about it and it never happened. So what I encourage people to do with worrying is this idea of distancing, where if you have a thought and you're about to fall asleep and you're like, what if my cancer comes back? Which is a valid concern. And I don't want you to start quoting statistics or start researching recurrence rates. Instead, just reminding yourself, okay, my mind is worried about my health because it matters to me. Is there anything I can do tomorrow to help me feel healthy? So you're accepting the worry, you're accepting the anxiety as part of being okay, part of being alive, part of being here, part of caring about your health. You're saying, okay, brain, thank you for the reminder, but I can't fix that. So I'm going to make sure that I'm living a healthy life tomorrow. I'll make sure to do something that helps me feel healthy. You're basically looking for action you can take out of what ends up being a very frightening thought. You're trying to take a little piece of it and saying, I can't control that, but I can control this. The alternative to that is if your brain says, what if my cancer comes back? And you saying, no, don't think about that. Don't go there. You basically prove to your mind that this is important, and it will go back. It's going to be like whack-a-mole. It's going to pop up in different places. So that's recommendation of how we manage worries. And in fact, if you really struggle with worries, sometimes even before bed, I would recommend doing this, or during a tough day, where you write down what you're worried about. You write down if it's controllable or not, and you write down what steps you can take. And that might help you develop an action plan for the worries that are actually controllable, that sometimes get lost in a busy mind of uncontrollable worries. So sometimes by writing it out, it helps us dismiss it from our mind a little bit. I've heard from a lot of people that doing this an hour or so before bed allows them to just like go to bed without their mind running amok, because they can say, listen, I already dealt with this earlier. I can't fix it all today, so I'm off the hook. Okay, we talked about keeping anxiety in perspective. I'm going to make sure, I'm going to kind of push through some of these here because I want to make sure we have some time for additional questions at the end. Remember, anxiety is something your body is doing. It's a guess. It is a guess about what could go wrong. It is bullying, it's trying to bully you into taking action. Be, just because you're having anxiety doesn't mean that something is wrong. And notice how anxiety can happen even when things are going okay, which is sort of proof that it's not just a reaction to things being wrong, but it's almost like a reaction to when things go okay, because your brain's like, well, I don't want to get my hopes up too high. So anxiety, it's something your body does, and your reaction to anxiety can determine, does it get better or does it get worse? If you decide to you feel anxious and you decide to not go to that social gathering, or you get anxious and you don't go to your doctor's appointment, or you get anxious and you just kind of withdraw or isolate yourself from important things, the anxiety is sort of like, okay, I guess we're right, because look what he did. He didn't go. So I'm glad we felt anxiety beforehand because he stayed home. Whereas if you go and it goes okay, your anxiety learns that that situation wasn't actually dangerous, that you can get through it even if it's stressful. So I'm going to continue to encourage people to engage in important areas. Anxiety is a reminder of what matters to you. So when you're having it, again, it's like, thank you for the reminder, brain. I don't quite need it that intense, but thank you for the reminder, and I'm going to just stay on my path. I'm going to keep focusing on what matters. This is an idea of acceptance. Anxiety is a package deal that comes along with caring about things. Anxiety, it comes along with going out of our comfort zone, but going out of our comfort zone can sometimes be very important and meaningful to us. So just because we feel anxiety doesn't mean we should back off. When we feel anxiety and we still do the things that matter, that is a form of acceptance. We feel best in our lives when we are engaged in important areas. That gets threatened through cancer. We sometimes have to quit our jobs. We can't see our family as often as we want to. We maybe don't have the energy to do things. So as best as you can through treatment and after treatment, I encourage staying engaged, getting re-engaged, just trying to get back into life as much as you can, being very specific. I'm going to give some examples in each of these areas, being very specific about what you can do in these areas, and trying to focus on just the first step. Because if you go through your cancer treatment and now you think like, okay, well, I just have to put my whole life back together tomorrow. That you don't even know where to start with that. But if you're specific about what matters to you, you're specific about who matters to you, you can then come up with the first step you got to take. And a lot of times, once you take that first step, you remember how much it matters, you enjoy it, and it's easier to take those next steps. So we can do all these things even while we are experiencing anxiety. And in fact, I would say if you know you have scans or something coming up, maybe getting even more involved in these important areas can help you stay on your path. Um, if you want to clean the house, don't think about cleaning the house. Think about the first thing you need to do. I need to wipe off the counters. Do I need to reorganize my entire basement today? You can't. You can't think of it that way. It's going to feel overwhelming. Start with box number one. If you used to walk for, an hour a day and your body feels exhausted now because of your treatments, just try a 5-minute walk. How does that go? Don't think that you have to do it exactly the same way that you did. Promise yourself and commit that once you get moving for the day, you will feel better, and it will help you even for the next time. If you're trying these things and it's not getting better, I would encourage you to work with somebody, work with a counselor. It doesn't have to be someone who's an expert in cancer. or health problems, but because a lot of what we talked about helps people regardless of why they're experiencing things like depression or anxiety. We want to shoot for evidence-based approaches like cognitive behavioral therapy or acceptance and commitment therapy. Everything I've talked to you about, these recommendations are built out of cognitive behavioral therapy and acceptance and commitment therapy. Look for a licensed provider, someone who has a degree in mental health in some fashion, whether that's through the social work route or through like a PhD or a PsyD. And sometimes people help with just getting on a little bit of medicine to help them through some of the stressful times. There are medications that can help that you take it only when you need it, like an anti-anxiety medication like Xanax or Ativan, but those come with some risks of dependence, and it's almost too focused on just making anxiety go away, where instead of your brain realizing you're safe, it's like, well, I'm safe if I have my Ativan, and that's kind of the wrong message we're shooting for. So I would actually recommend a medication that you would take regularly. Those could be like SSRIs, Lexapro, Prozac, like different medications that you could take every day that might just help take the edge off of things. And some people are like, gosh, Mills, I don't want to add another medicine on, right? Yeah, I've already taken so many medications. I still have a full pill box. And that's just a discussion you can have with your doctor or a therapist. For some people, it is worth one little pill to sort of help you get your life back and get control over anxiety. It sometimes is worth it for them. And for other people, they want to try other approaches first. Therapy and medication both have pretty good success rates on their own. And if you combine them, it maybe increases it a little bit, but you can get help one way or the other. Now, I did say there's some specific situations where maybe the scan of it's literal actual scanxiety. It's the actual scan, like an MRI machine, that is causing the anxiety. You don't even care what the outcome is going to be, but you're claustrophobic or terrified of the machine itself. Sometimes your medical team can give you some medicine to get through the scan, and that's a perfectly fine option. But also at Nebraska Medicine, we have this sort of revolutionary new program that is using virtual reality to help people get comfortable with, and the virtual room looks exactly like the MRI machines at Nebraska Medicine. And many people, through one or two treatments, have had really significant success in getting comfortable and getting through their scans by going through this virtual program. And so you'd think that if it looks like a video game that maybe it wouldn't help, but virtual reality exposure treatment is very highly effective. And so that's always an option as well for that specific kind of case. Okay, I used recent relevant references to back up what I'm saying today. And I wanted to mention that the photos used today are from sites that allow photos to be used with credit to the photographers. I'm not selling any of them or using them for other personal gains. That is all I had. And if we have a little bit of time, I'll try to answer some questions as well.
Dr. Mills, Judy, can you hear me? Judy Smith, do you want to ask Dr. Mills a question? You have to come off mute, dear. Let me see if I can. Oh, you're still muted. I think Judy's struggling a little bit. Well,
Yeah, I can't
I do
unmute.
know that Judy is really having a tough time because she's got a recurring cancer. She went many years with being a survivor, and now it's come back. And she's got some upcoming. She's got an upcoming ultrasound on the 19th, and she's just really struggling. So she just wanted to know. She said she's nervous, anxious, and I know she's sat here and listened to a lot of what's going on. I wish I could unmute her myself, but all
I
I could
know,
do
I
is
wish I could
ask
too.
to unmute, and I'll try that again. But or Judy, if you just want to type it out, if that would help. But does anyone else also have questions? If you could put them in the chat real quick. That would be helpful. And I'm so sorry, Judy. I can't get you.
Technologies.
I know technology is great when it
And
works.
is there any way that like questions that may pop up later, could they contact Emily and have them get forwarded to me or anything like that?
Absolutely. Folks, if you have follow-up questions for Dr. Mills, you can email us at info, atth.org. A is in apple, T is in Tom, T is in Tom, H is in horse.org. Okay. So info@atth.org. And we would be happy to forward those on to Dr. Mills to answer your questions. In addition, if you go to the resources page on our website, I believe you will find some videos on the topic of anxiety. Also, our YouTube channel, we're going to be sending you out a link to this video on our YouTube channel. So once you get that link, you can look at all the other videos we've done, and Dr. Mills has spoken us with for us before, and you can find some more videos on the topic as well. I will tell you that his wonderful advice about practicing your breathing absolutely works. I'm old enough that I remember being taught Lamaze breathing.
Yeah.
Yeah, I see lots of heads nodding. It's very similar, very, very similar. And just kind of doing that ragdoll or limp feeling of your muscles at the same time. And it really works, especially for pain. Just kind of trying to deal with pain, or I just had a shot in my big toe. Can you imagine? It and the doctor was very impressed because I said, "Hang on a second," and I went into my breathing. He said, "Wow," because I knew it would help me relax. So it really does work. I encourage you to practice it and try it. And I love all the information, Dr. Mills. Thank you so much. You gave us so much to work with. Really appreciate it.
Yeah.
Judy said, yeah, she just could to continue to talk about scared of results of things coming back. And I know you covered that. Is there anything you want to add about that, Dr. Mills?
Yeah, it's just obviously, no matter how long you go or whatever happens, like good news, bad news, like the mind is we got to where we are now because our mind is good at finding threat. And this happens in a millisecond. I did research on this in grad school where we had people um basically seeing threatening images on a computer screen, and their brains reacted to those images in less than a third of a second before they could even process what they were seeing. Our brains are very good at finding problems, and because we're all here today, all of our brains have taken that information. It basically feels like every bit of anxiety we've ever felt, our brain takes credit for that's the reason we're alive. Thanks, brain. Thanks for keeping us going. And so we will drift towards the negative. We will drift towards the negative, scary information. And so knowing that's what we're up against, it is normal to feel anxious and worried, whether you've had a series of good news or a series of bad news or mixed information or whatever. It's normal for people to feel scared of what could happen next. And so again, knowing we can't make that go away, it's how can we live? How can we create our best life despite that? How can we continue to be with the people that we want to be with? How can we keep our mind focused on enjoyable things, on distractions, keep our overall stress levels down despite the uncertainty that's in front of us? And that's just the greatest challenge. And that's why I still have a job, because if it was as simple as just do breathing exercises and you'll never feel anxious again, I'd probably be done and retired at this point. It is more complicated than that because uncertainty finds itself in so many other ways in our lives, and we worry about things even though we know we shouldn't. And so it's an ongoing battle, but it's one that you can make a difference on if you start to engage in some of these exercises. Get the information you need from your healthcare professionals. So get the info, and then control what you can control, and then focus the rest of your life on the stuff that matters. And again, thanks but no thanks, brain. Thanks for the reminder. Appreciate it. But I'm gonna cross that bridge when I get to it. There's a lot of canned responses you can say that can kind of help get through those moments.
Absolutely. And as a reminder, everyone, if you have not taken advantage of our free Survivorship 101 class, that may be something you want to consider. A lot of the things Dr. Mills has talked about today, we practice in that class.
Yes, in
And
much more
yep,
depth than what I covered in one slide for sure.
yep. And again, it's a free class. You have absolutely nothing to lose, and you get a free book with it as your resource book as well. Also, make sure you check out again our resource page on our website and other upcoming programs. It's been a privilege for me to watch this, to learn from you, Dr. Mills. I always learn from you. And it's been a privilege to watch these comments and see how supportive and loving everyone is of each other. Thank you all so much. You're all so important to us. Please, please, please always reach out to us if you need help in any way. We're here for you. So have a great rest of your Saturday, and thank you all again.
Thanks.
Thank you.